Hello, my name is Ivni, and my placement this semester has been with Jennifer Loonsbury, who is the Chief of Interprofessional Practice with a focus in oncology. In this video, I will go over Jennifer's role as Chief of Interprofessional Practice. I will review the literature about the role, compare the role observed in clinical practice with that described in the literature, and propose recommendations based on the literature, in addition to exploring the limitations of the role and how it is published. I have been focusing on working on an inpatient oncology model of care project, and the primary aim is to develop a model of care that will help with reducing hospital stays on the inpatient unit. The practice of the Chief of Interprofessional Practice focuses on interprofessional development for student and medical education, quality and value improvement, patient experience and safety, clinical and organizational ethics and whole person care, and clinical resources including volunteer resources. Here is a summary of Jennifer's position. She reports to the VP, Quality and Performance, and Chief Nursing Executive. The Chief of Interprofessional Practice is a senior-level management role focused on improving patient outcomes in collaboration with operational and medical program leadership, staff, and physicians. This is accomplished by providing expertise to enhance professional practice and interprofessional team performance. The chiefs are assigned to clinical areas of Hamilton Health Sciences to develop strong relationships and familiarity with their clients' strategic goals, priorities, and capacity. The chiefs also lead and participate in corporate projects. Key functions include continuing advancement of professional practice through empowerment of staff, education, remediation, policy development, and research. Appraising and facilitating redesign of models of care, workflows, and skills mixed through processes that engage teams and patients and families. Establishing, implementing, and evaluating standards of practice. Leading, supporting, and monitoring practice changes. Facilitating optimal use of technologies used in patient care and facilitating team performance. Supporting the adoption of research evidence and best practices. Contributing methods to improve team communications, performance, and resilience. Managing advanced practice staff who are in a dual reporting relationship with clinical operations directors. Now that we have gone over her role at Juravinski Cancer Center, I will highlight some of the key points in the literature about the role. Transformational leadership is an essential element of high-performing organization in this era of rapid healthcare delivery system evolution. An article by Noreen Bernard describes the senior leadership role of a nurse executive and chief of nursing position. Research shows that there is a key relationship between leadership effectiveness and organizational outcomes. There is a significant support for power of transformational leadership on a nurse's executive performance and organizational cultural metrics, including associate engagement, work environment scores, and clinical outcomes. Specifically, nurse executives have a responsibility for creating a clear and compelling vision for the creation of a professional practice environment, demonstrating competence in the areas of strategic thinking, developing the workforce, business planning, and creating a culture of patient safety. This article also highlights that nurse executives must be able to effectively plan, forecast, problem solve, and measure the value of clinical care delivery, all of which I have seen Jennifer take part in, especially in the Model of Care project alone, where she is leading the project to plan and problem solve to improve delivery of patient care and patient safety. The author states that when a nurse executive vacancy exists or when there is an absence of a competent nurse executive in an organization, instability, loss of momentum, loss of strategic focus, lack of representation at the executive level, and increased patient safety risks occur, leaving an ineffective and unstable work environment. Jennifer definitely ensures that all staff are focused on the organization's goals, helps to represent the registered nurses at an executive level where she is able to be a voice for their concerns and needs. The author in this article explains that to meet the healthcare system landscape changes, nursing and nurse leadership roles are changing. The role of the chief of nursing is no exception. These roles are no longer practicing within the walls of one hospital. The role is expanding to encompass leadership of multiple hospitals, system responsibility, and more importantly, to include healthcare outside of the walls of the hospital. According to Clark, to provide leadership in the new healthcare system model, an increasing number of system chief nurse executives have been employed to both facilitate the integration of care and to align and standardize nursing practice across the continuum. Although this article highlights a current change in practice for chief nursing executives, Jennifer's work pertains only to the Dravinsky Cancer Center. But I can see the benefits of practicing at multiple hospitals, as this could allow for greater collaboration and the opportunity for more widespread systemic change. Padraig and Francis aim to explore and identify the core elements of the nurse executive role and the contribution these positions make to health service organizations in terms of quality and performance. They pointed out that while the overall literature is limited in relation to the role and function of nurse executives, there are strong and recurrent themes indicating that nurses, by virtue of their professional background and experience, can provide effective and influential input to executive boards. Executive nurses are well positioned to influence and lead professional governance, quality improvement, service transformation, and change and shared governance. The authors pointed out that although the role of nursing executives may be questioned, the evidence supports the positive impact of highly skilled nursing executives in contributing to the implementation of effective health services. Therefore, successful health services should be engaging nurse executives who have the high level of expertise, education, and the best leadership and management. I agree that nurse executives are in a position where they have the opportunity to improve the quality and performance of the organization. Similar to what the article highlights, Jennifer's 5 key areas of practice includes quality and value improvement. The Model Care Project also falls under quality and value improvement, and I have gotten to sit in on executive board meetings where I have seen the value that a nurse executive can bring. She is able to provide the perspective of the nurses working in the hospital at the bedside and be a liaison between the board and the staff. As part of her role, she works on the planning, research, and implementation and evaluation components of quality improvement projects. This other article highlighted that the nurse executive's participation promotes the enculturation of the shared decision-making process for the frontline staff, increase nurse satisfaction and retention by empowering the staff nurses to be involved in decision-making, which impacted their practice environment and the organization's healthcare mission. Similar to what I said about how I have seen Jennifer be a voice for the frontline staff, this article highlights how important this is as it increases the frontline nurses' satisfaction and retention, which then improves the overall practice environment of the organization. This article explores the chief nursing characteristics that are required for success in these increasingly responsible and visible roles. The system chief nurse is charged with improving clinical outcomes for the organization. This role uses clinical performance improvement goals as an integration strategy to align disparate and often conflicting priorities in the organization. To accomplish this, the nurse executive creates structures, processes, tools, and relationships that enable collaboration and define accountability. The nurse executive role creates organizational coherence by directing clinical activities that are corresponding to the stated purpose and goals of the system. I have found that in Jennifer's practice, her focus for any task or project that she is working on always relates back to the organization's values, goals, and missions. Additionally, this article highlights that the role requires unique skills in translating clinical performance demands into operating strategies and tactics. The successful nurse executive creates shifts in clinical practice and patient outcomes. The continued growth of the system chief nursing role has the potential to accelerate change in nursing practice and patient care delivery for the healthcare industry. As the healthcare system continues to evolve toward more integrated care, a trend toward consolidation of hospitals into larger systems continues. To provide leadership in these new models, there have been an increasing number of system chief nurse executives hired both to facilitate the integration of care and to align and standardize nursing practice across the continuum. Nurse chief executives work to establish desired nursing outcomes relevant to nursing practice. Desired performance is determined by a variety of internal and external factors, and the system nurse chief continuously monitors entity and overall performance, advocating as necessary for systems and processes needed to provide safe and effective care of patients. This is similar to how Jennifer advocated for the need to change in the nurse's model of care and working to redesign the model of care to help provide safer and more effective care to patients. The Chief of Nursing is also responsible for promoting and maintaining positive relationships with local academic institutions. These relationships revolve around education of nurses, shared areas of nursing inquiry and development of evidence-based practice, and other areas of mutual interest and concern. The Chief Nursing Executive understands all of the system implications for nursing education and will take a lead role in establishing and exploring new and established partnerships with academic organizations to meet the needs of the overall system. Jennifer Loonsbury is an assistant clinical professor for the nursing faculty at the Faculty of Health Sciences Department at McMaster University. Jennifer is also the Hamilton Health Sciences Virtual Nursing Team Lead, working on a team of researchers and healthcare providers at Hamilton Health Sciences and McMaster University that have launched a major Canadian study to remotely manage patients after surgery. As healthcare systems consolidate, the chief nursing executive role is emerging as an important and strategic member of the healthcare system. This article discusses the trends in this role, including the structure and function in today's healthcare system. Most chief nurses have ascended to the role from a hospital clinical nurse role and hold at least a master's degree in nursing. Degrees in business and health administration are common. A little over one-third of nurse chiefs are doctorally prepared, holding either a PhD or DNP. Almost all chief nurse executives have specialty certification in nurse executive practice and/or as a healthcare executive. In addition to broad responsibility for nursing across the system, clinical education, academic relationships, and schools of nursing, if present, and care management commonly report to the chief nurses. Pharmacy, clinical quality, patient safety, infection control, ambulatory clinics, and a myriad of other clinical and patient-facing services may report to this role. It is common for this role to lead key system initiatives such as patient experience. Nurse executives are positioned to ensure that nursing is represented and strategically engaged in decisions that will reshape our healthcare system and improve the health of the communities we serve. While the Chief of Nursing role is increasingly present in the health systems, support for this role and its appropriate design is critical for the success and impact on nursing practice. It is important to ensure that this role is well defined and supported in the healthcare leadership. This role is, by nature of its system focus, uniquely different from site-based nursing leadership, and it represents nursing and patient care at the highest levels of healthcare organizations. It is important that this group of nursing leaders is creating its own community of support and networking. There is evidently a lack of literature on the specific role Jennifer has as the Chief of Interprofessional Practice. Greater research on this role can allow for better implementation of the role across healthcare systems. Thank you.